There are several ways of adding orders in CanTime. The first way is adding a medication directly from the e-chart. Within your nurse's note, the very first tab is Pediatric SN Visit. That is where you complete your assessment, your INOs, and your narrative notes. The Interventions tab is where you will complete your treatment records. The next tab we use is the Medications tab. These are our MARs, but this is also where you can do a change order. By clicking New Change Order, you would follow the process discussed in the first video, how to do MD orders in CanTime. We will touch base on that rather briefly and quickly using the alternative method shortly. Another way of accessing MD orders in CanTime is through the patient profile. Anytime you select the patient's name in CanTime, it will take you to the patient profile, which is essentially the patient's chart. Okay, so one way would be client list and select your patient's name. Another way would be schedule list and select your patient name. Again, anywhere in CanTime, if you select your patient name, it will direct you to the patient profile. From the patient profile, select the Orders tab. Off on the right-hand side, you'll see New Order. The primary type of order you will be using would be the change order. The two types of orders in CanTime that you may use would be the physician order and the change order. Remember, the change order is for any change that needs to be reflected on the plan of care, any change to the MARS or any change to the care plan. This includes brand new meds that were not on the MARS before need to be added. That is a change. You would do a change order. Physician orders would be non-medication or non-feeding orders like follow-up in 2 weeks, lab work, DME equipment being ordered, not the use of, because that would be a change order under interventions. If I select change order, I would see the add change order box. I'd have to fill out my asterisks, including your signature at the very bottom, before you can do any changes. If I've selected change in medication, I will see my medication list listed here. If I've selected change in medication and change in care plan, I will see the Edit Interventions button located well below the medication list. I'd look for the medication that needs to be changed by first discontinuing it. So I click on the name of the medication, I discontinue it, I save, and then I come back here and add a new medication. So remember, if a medication has a change in dosage or a change in frequency, you are not just going to edit the existing med. You must first DC and then add a new medication. If I have selected both a change in medication and a change in care plan, I would do the same process as discussed in the previous video of how to create a care plan change order. By selecting Edit Interventions, looking for the intervention I want to discontinue, clicking on Edit on the far right-hand side, checking discontinued and adding the DC date. I would hit save, and just like the medications, after I DC, I would add the new intervention. Discipline SN, area based off of the order. Look for a box that does not have a check mark. Check mark it, remove the template that is there by deleting it entirely and making it your own order. Then hit save. Repeat the process as necessary for both medication changes and care plan changes. One of the final steps will be to hit autofill on the upper right-hand corner above order description once all changes have been completed. Review the order description and add any necessary information that may be lacking. Once completed, save and submit your order. Whether you create the order from within a note or from your patient profile, you always have access from your patient profile. Again, from the patient profile, the Orders tab, be sure that you are in the correct certification period. Anytime you see this little triangle pointing down here, it is a pull-down menu. You have options available to select from. If I am in the right cert period, I won't expect you to remember the order number of the order you created, but you do know more or less the order date that you created the order. You'd use that as a reference and then click on the actual order number itself. Nowhere else, the order number itself. By clicking on that order number, you have access to that very same order that you created, only now it is listed as Modify Change Order instead of Add Change Order. Here you will be able to complete any corrections asked of you by QA, medical records, or your case manager. Here is also where you'll be able to change your physician if necessary. If at first you do not see the physician listed, you may text me or call me or email me and I will add the information in CanTime for you. However, do not wait for me to put in the physician name. You need to document on the MARS, you need to document on the care plan, as do the clinicians after you. You can modify the name of the physician at a later time. And then hit Save and Submit. When corrections are sent back to you, they should be sent to you in a message. You will find this on your home screen dashboard. The nice thing about it is you will not have to open up the patient's profile. You will not have to look for the order itself. It will be automatically attached to the order. Once I click on the email, it opens up this screen. It tells me what my corrections are. All I have to do is click Open Order/Note and it will open the order for me to do the corrections. Hit Save and Submit. So it is imperative that you read your messages and that you do your corrections as soon as possible.